Hello ladies and gentlemen, how are you today? Now then, we're going to cover the topic of situational judgment. This is the first part, and it's part of the UCAT course which you want to learn about. So I shall be covering that with you. My name is Dr. Abdul Manan. I'm a director at Blue Peanuts. Now then, very briefly about the organisation. As you might know, we've been doing this work since 2003. Our combined team experience is well over 30 years worth of doing this kind of work with students from UK schools and colleges. And really, from an operational point of view, we've been doing this since 2005. Particularly, our work focuses around mentoring and coaching, providing bespoke training around UCAT, BMAT, preparing students for those tests, helping people out with their personal statements, and very importantly, preparing for their interviews. For more information, please go to our website, www.bluepeanut.co.uk. Here it is. Do feel free to go and roam on our website and have a look. All right. Now, what's it all about? What is the UCAT consortium testing goes when it comes to situational judgment? To put it in a nutshell, ladies and gentlemen, it's about how are you as a person, what potential do you have in becoming a doctor? Do you possess some of the fundamental traits required in a doctor who is going to practice within the UK? And these kind of fundamental skill sets include things like how is your integrity? What kind of perspective can you take in certain situations? Are you a team player? Are you a resilient person? Can you adapt to changing and difficult circumstances? What about ethics? What about moral issues, these dilemmas? How are you going to handle it? How are you going to manage it? What about your ability to manage conflict resolution? And also, when it comes to medical and dental school interviews, how you might perform as a person. Now, these are the kind of things that you are being tested on. And it's really, we prepared well, not difficult. Now let's give you some other fundamentals in terms of what this section of the test involves. Look, as you can see, there's not much time, 26 minutes, no more than that, to answer 69 questions associated with something like 22 scenarios. And within each question, you've got between 2 and 5 the kind of stems, shall I say, questions within questions that you're going to have to address. They tend to deal with real life clinical and educational scenarios involving situations like conflict, and many of them involve you stepping into the shoes of a medical student. How would you conduct yourself in that situation? The two strands of questions are about appropriateness and importance. I'll be going through those types of questions later on and explaining them a bit more. And also you get banded into band 1, 2, 3 and 4, and depending on how good you are in answering these questions, you get put into better bands, and these determine whether you are successful in getting through to a university interview, and in some cases, even after interview, whether you then are given a place. Sometimes some medical universities and dental universities for that matter, they will take this into account, your situational judgment and which band you fit into. Generally speaking, this is one section that these schools tend not to look at as much as they look at the other 4 sections, so just do bear that in mind. Bit more about the questions. Look, bottom line is you don't have a lot of time. There's 69 questions, as I said. You've only got 26 minutes to answer. And really, if you think about reading each question, it's going to take you around about 30 seconds to read and process, which means it takes up about 10 minutes of your total time. Now, if you do the maths, that just leaves you with 16 minutes of answering time. And I've worked it out for you. That's no more than 15 seconds per question, which means if you don't practice, if you don't get slick at this, you're not going to be fast. you're not going to be agile, and you are going to be indecisive rather than decisive, and therefore you will not answer these questions well. So listen to me and work with me over the next few slides. Appropriateness. In these types of questions, they will give you 4 options. For each scenario in the question, each STEM, you have to decide, is this a very appropriate thing to do? All right. Is this an appropriate but not so ideal, i.e. it can be done but not necessarily the best course of action? Is it inappropriate? If so, is it inappropriate but not awful, or is it a very inappropriate thing to do? So really the clear distinction here is about appropriateness and inappropriateness, and you need to split that situation and decide where it's going, and then decide, is it very or not so very in both sets of situations. All right, so that's the appropriateness questions. The importance questions work on a very similar fundamental, in that you decide, is it important or is it not important? If it is important, is it very important as opposed to just important? Is it of minor importance as opposed to not important at all? So again, can you see there are pretty much 2 sections you can kind of split this into: the important area and the not so important areas. I'll give you a few key tips to take from here, and that is you need to have an element of knowledge behind these topics. You have to be able to understand certain pre-existing medical issues, and I'll give you some tips on how to improve on that and how to learn all that. It's important that you don't spend too much time pondering over your responses. You'll waste time and you'll get things wrong. All right. Each question, make sure you look at it independently from the previous question. Don't link questions up and try to rank them. Okay. Only answer based on facts, and you should never assume. All right. And beware of actions provided that are not so important. Okay. Besides that, a few more tips. There's the full marks versus the partial marks debate. I'm not going to go into that too much today, except I would suggest to you answer every question the best you can. Don't think about, oh, this could be partly right, partly not right. No, that's for the examiners to decide whether they give you partial marks. You need to assume that it all counts and it's all very important. Read the scenarios very carefully. We have problems with students not reading scenarios properly, and therefore they get the STEM answers wrong. Don't spend too much time. Like I said, we haven't got time. Be quick about it, and you need to review all official questions on the UCAT consortium site to understand what this is all about. Now then, this is something that you medics need to really get into grips with. This document, download it from the GMC website. It talks about good medical practice. It underpins most of the knowledge base you need to do this section. It talks about achieving good medical practice. It talks about good medical practice as a doctor. It's very, very important you cover this document. You can actually go to the MSc website and look this up as well, and you can go through it in your own time. You must do these things, guys, before you do our exam questions, or indeed anyone's test questions. So you must go through this document. For you dentists out there, make sure you cover this, the equivalent, on the GDC website. For the vets we come across sometime, make sure you go through the Code of Professional Conduct on your website. It's very similar. It's just been worded differently depending on your professions. Okay, in terms of knowledge, skills and performance, if you read those documents well, guys, you'll know exactly what these 3 key words mean. In a nutshell, it's about care. You need to make care the most pressing concern. Your patient should be your first concern. You need to be up to date in terms of your knowledge and skills, and you need to recognize and work within your competence. It's about being safe, guys. So you must understand these 3 breakdown issues when it comes to knowledge, skills and performance. So let's have a quick chat about making the care of your patients first concern. Please don't just rely on me talking here. Read that document, read those documents I've just told you about. All decisions that you make should benefit the patients. You must understand that and accept that. Work colleagues, I'm sorry to say, they come second. They must not at any point, whatever they do, they must not undermine patient care, nor should you undermine each other. Okay. The last importance is yourself in a sense, in that your patient concern comes first, and also your welfare of your colleagues as well. And that goes back to what I've said before, your patient's concern. Your patient should be safe at all times from yourself and from your colleagues. Okay, so let's have a look at a question. Here we have a question where I'm told that you are a medical student in a general practice. One of your patients needs a follow-up appointment, and you send the receptionist a message from the computer system to book this. She comes to you very angry and says she does not like computers and tells you to write your request on a post-it note and hand it to her in person rather than send a message. How appropriate are the following next steps? So you can see straight away this question is talking about what's appropriate versus inappropriate. So you need to basically decide these particular questions, do they fall into appropriate or inappropriate, and then you can work out whether they're very or not so very, or whether they are very or appropriate or not so appropriate. So let's have a look at the first one here. You tell the receptionist to keep up with the times and learn how to use